Hello guys, good evening. Today we're going to study a new topic called as mycology. Okay, I'm going to share you a small PPT so that you could find all the important points regarding the mycology. Okay, yeah, here is our PPT. Let us start mycology. So, what is mycology? Let's start from the basics, right? What is mycology? Mycos. The word myco is a Greek word which literally means fungus. So, and logy is obviously a study. So, the study of fungus is called as mycology. Okay, this is the basic part. And then we're going to see the characteristics of fungus. Like every individual has some sort of specific characteristics. In the same way, the fungus also has few characteristics which are very important for us to memorize. Okay, the first thing, the people may ask you, fungus, is it a prokaryote or a eukaryote? Yeah, because see, I'm just deviating from the topic, but I want to give you some exact idea regarding this. Okay, see, what I mean to say, the bacteria are, they are prokaryotes. Okay, and the viruses, those are neither prokaryotes nor eukaryotes. And whereas our fungus mycology, they are eukaryotes. Okay, they may be unicellular or maybe multicellular. Okay, next, they may divide maybe through asexual route or by sexual route or even by both the processes. Now, morphologically, I mean to say, if there is a fungus nearby you, by seeing it, how you gonna differentiate it? So I'm gonna classify the fungus based on the morphology into five types. Okay, what are those five types? There is actually four types, and fifth one is something I'll let you know. Okay, first of all is yeast, and the examples for the yeasts are Cryptococcus neoformans. Okay, and there are some other fungi, those are acting like yeasts. Okay, those are not yeasts, but they are like yeast, and the example for this is Candida. And next comes our molds, and I have given some sort of mnemonic kind of thing here, that is ramp. Okay, some sort of ramp walk. So what do you mean by ramp? Ramp is a mnemonic to just memorize the names Rhizopus, Aspergillus, Mucor, and Penicillium. Okay, yeah, Penicillium is a fungus. Everybody know it. Do you guys have some idea that Alexander Fleming has discovered penicillin, which is an antibiotic, and this was discovered from a fungus called as Penicillium notatum. Okay, and there are some other fungus which have some dimorphicity. So what do you mean by dimorphicity? Dimorphicity is nothing but these fungi are in two different shapes. Okay, yeah, that can't be practical, right? At a particular given time, nobody can be in two different morphologies. So if the temperature is around 37 degrees, these fungus, they act like yeasts. Whereas if the temperature drops, if the temperature is somewhere around 22 to 25 degrees centigrade, then they act like molds. Okay, then I have given one more special mnemonic over here, that is State Bank has powerful PC. PC is nothing but some sort of powerful, personal computer, right? So I have given this mnemonic just to see the state is starting with alphabet S, so that indicates sporothrix, and B indicates blastomycosis, H indicates histoplasma, P powerful, P is penicilliosis marfani, and P is paracoccidiosis, and the last C is coccidiosis. Okay, next, and there's one more point to remember. This is nothing but sexual spores. So what are the sexual spores? See, uh, there is some beautiful mnemonic. You can say like, actually it's in Hindi, sex bars. So you can remember this by the name as bars, like basidiospore, ascospore, and zygospore. Okay, what comes under the basidiospore? That is nothing but your cryptococcus comes under your basidiospore. Next, ascospores are nothing but your aspergillus fungus comes under there, and the zygospores is nothing but your rhizopus fungus. Okay, except these three, all the other are forming asexual spores, and these asexual spores are called as conidia. Okay, those called as? Those are called as conidia. Okay, see, I'm going to give you some diagrams here. This is a septate hyphae. Okay, this is, and in this particular thing, if you see carefully, you're not seeing any sort of septa in between. So this is a septate hyphae or non-septate hyphae, and this over here is a zygospore. Sorry, I mean to say, see, this septate hyphae is example for this is aspergillus, whereas for this non-septate hyphae, the examples are rhizopus and apsida. Okay, next, this is a zygospore, and this is your ascospore, and this is your basidiospore. Okay, let's move on. Here you're gonna see a pathogenic classification. From here, the topic becomes really interesting. So what is this? The primary pathogenic. The, these funguses are primarily pathogenic. So what does this statement say? This states that Joby, yeah, I'll be using a bit of Hindi over here if it's not a problem for you guys. The thing is, I mean, this is just to make you feel more comfortable and make some sort of good interaction. Okay. Yeah, simultaneously I'll be speaking in English as well. Okay. Next. Uh, these primarily pathogens, those fungi causes the infection in healthy individuals. Okay, all the dimorphic fungus which we just studied, right? And I've given the mnemonic as well for the dimorphic fungus, if you guys remember. See, the dimorphic fungus are nothing but your Sporothrix, Blastomycosis, Histoplasma, Penicillosis marfani, Paracoccidiosis, and Coccidiosis. Okay, these funguses, they cause the infection in healthy individuals. So these are primarily pathogenic, and few funguses are opportunistic. So what do you mean by opportunistic? See, these fungus, they generally doesn't affect a particular human being, but they do affect only when a person is immunocompromised. So what do you mean by immunocompromised? A person's immune system, if it is suppressed, so in that particular condition, these fungi attacks him. Okay, like HIV, diabetes mellitus patients, and all those patients, you see this opportunistic infections. Yeah. Next, uh, actual infections of the tissue, which is called as mycosis. This is nothing but a pathogenic fungi. Okay, what does this pathogenic fungi causes? This is the actual infections of the tissues, which is known as mycosis. And under this, we're going to study the superficial mycosis, cutaneous mycosis, subcutaneous mycosis, deep or the visceral mycosis. In these fungi is present in the tissues to cause pathogenic effect. Okay, so in this actual infection of the tissue, what's happening? The fungus is present in the tissue, and that is causing the particular pathogenic effect in the human being. Next, we're gonna see this mycotoxicosis. Yeah, what is mycotoxicosis? See, that you can, in this particular word you can see this toxic. Okay, by this term you need to understand like this is something related with toxins. Okay, in this disease is due to the toxic metabolic products which are released by the fungus. This particular fungi is releasing some sort of metabolic products which are toxic to our body. Okay, the examples for this are aflatoxicosis. This occurs due to the consumption of grains which are containing aflatoxins. Those are secreted by a particular fungus called as Aspergillus flavus. Okay. Next is ergotism. So what do you mean by ergotism? This is after the ingestion of rye contaminated by Claviceps purpura. Okay, this Claviceps purpura is a fungus that might be secreting some sort of toxins in rye, and if you take that rye, so you'll suffer with ergotism. Okay, and do you know that these fungal reactions are they cause some sort of allergic reactions? Nothing but the hypersensitivity. So under which hypersensitivity these fungal infections causes? That is both type 1 and type 3 hypersensitivity. Okay, so how it gonna be provoked? See, for example, in some sort of spring season, probably in majority, in few countries, there'll be the pollen grains are released from the plants, right? So along with the pollen grains, for example, if there is some sort of fungal spores, and these spores got inhaled by a particular human being, okay, noticeably, probably that is Aspergillus fumigatus fungal spores. Okay, so this causes some sort of allergic reactions in the body, like, so what they do, they cause our bronchi to constrict. As soon as our bronchi gets constricted, the particular person has some sort of breathing or the respiratory difficulties. Okay, as well as some sort of allergic fungal rhinosinusitis. You might be noticing few people, they'll be frequently getting some sort of flu-like symptoms, right? So rhinosinusitis. This is also caused by fungus. Okay, let's move on. Let's see our next slide. Yeah, here comes our culture media. So this is at most important question. Okay, they might be asking you what is the culture media for fungus. You need to say SDA. That is Sobrans dextrose agar, and the pH the pH for the fungus is 5.4. I mean to say at this particular pH the fungi grows very happily. Okay, next let us see few fungal stains. What are those fungal stains? That is LPCB, that is nothing but lactophenol cotton blue. Gomori stain, okay, which gives black color. This is seen in pneumocystis. PAS is nothing but the periodic acid shift, which gives red color. The Indian ink. This Indian ink is a negative stain, and this is used for the capsulated organisms. Okay, so this Cryptococcus is a fungus which is capsulated. Okay, the fungus. So what you need to know, what is the special point in this? The Cryptococcus fungus is a capsulated fungus. Okay, next, H and E, that is the hematoxylin and eosin stain. And also you see the calculofluor white stain, that is CFW, which is a fluorescent stain. Yeah, here what is the basic stuffs. Okay, the basic stuffs are done. Okay, um, now we're gonna deal with the the particular, the important stuffs. Okay, we're gonna see the superficial fungal infections. What are the superficial fungal infections? See, the fungal infection may be superficial, maybe cutaneous, maybe deep. So let's divide everything and go through each and every point particularly. So now we're going to see the superficial fungus. Yeah, so what comes under this superficial fungus? We're going to see the four types of fungus, which are nothing but Pityriasis versicola. This is also called as Tinea versicola. And the second is Candida. And next is Tinea, which causes dermatophytosis. And the last is Pydra. Okay, let us go through each and everything. Okay, let us move one by one. Now we're going to see the Tinea versicola. Okay, our first superficial infection is Tinea versicola or Pityriasis versicola. This Pityriasis versicola is caused by a fungus called as Malassezia furfur, yeah, or Malassezia globosi. And these formerly means, a few time before, this was called as Pityrosporum orbiculaire. Okay, this Pityrosporum orbiculaire was believed to cause the Pityriasis versicola. Okay, so what is the presentation of this patient, particularly who is suffering from the Pityriasis versicolor, is having some sort of hypopigmented patches. Okay, what do you mean by hypopigmented patches? The skin over there loses melanin. Okay, it does not have melanin. Melanin is the substance which gives color to our body, right? So when there is absence of melanin, that particular area becomes pale, or probably due to some defect, then that might be less pigmented. So that is what we say hypopigmented. Okay, generally seen in trunk region, and this is also seen in facial area for children. Yeah, images are quite important, so I have collected few images for you, and I'm going to show you the pityriasis versicolor image. See the baby over here, you can see some sort of hypopigmented patches on the, where, on his chest region, that is trunk region, and also it might be present on the back. And see, you can also see the baby is having some sort of hypopigmented patches on the, I mean, to say on the face. Okay, so on, even on the cheeks and all. So by this you say that the baby is suffering with tinea versicola. And also this, see, this is seen under microscopy. uh, so what is the characteristic feature of pityriasis versicola is, you can see the spaghetti meatball appearance. See, how do I say, I mean, why I'm saying this is a spaghetti meatball appearance? See, these are like noodles. Okay, can you see these guys? Yeah, these are like noodles, and this noodle is nothing but spaghetti, and this a bunch like structure, this is like, what to say, I mean, a meatball like. So that is why we call this as meatball appearance. Okay, spaghetti meatball appearance. Yes. See, under wood lamp examination, if you particularly examine this patient under wood lamp is a technique used by our dermatologists to see the change in color of the skin. So whenever the wood lamp, under the wood lamp, if I'm seeing the particular patient's skin surface, who is suffering with tinea versicola or the pityriasis versicola, I can see the golden yellow color or the apple green color. Okay, next, if I see under microscopy, I have just taught you that you're going to see the spaghetti meatball appearance. So what sort of appearance you're going to see? You're going to see the spaghetti meatball appearance or the noodle appearance. Yeah, this is probably an important question, an image-based question as well. Next, under SDA. What is SDA, guys? Do you remember? Yeah, SDA is Seborrheic dextrose agar. Okay, I told you, right? For the culture, we use this Seborrheic dextrose agar. So what does this do? This, and in this Seborrheic dextrose agar, you see the growth of fungus. Okay, the fungus is growing on the Seborrheic dextrose agar for culture, and you see, you're gonna see the fried egg appearance. Okay, we're gonna see fried egg appearance, and the drug of choice for the tinea versicolor is, we can give any of the imidazole derivatives. Okay, and we may also give this selenium sulfide, etc. And the second infection is our candida. So what is this candida? This candida is caused by Candida albicans. Candida is also a fungus. All of you guys know, right? And this candida is also an opportunistic infection. For example, if there is a patient who is suffering with HIV, and if his CD4 count is less than 500, so what's happening? The patient's CD4 count is less. So in this particular condition, he might be attacked by the fungus called as candida. Okay. Next, you see the chlamydiospores in this, and we use the, I mean, a special kind of agar called as cornmeal agar. This is seen in pregnancy as well. Candidal infections can be seen in during pregnancy also, and during germ tube test, which is also known as Renault broad phenomena. This shows a formation of germ tube. Yeah, I didn't get this image, but I'll try to send you guys again. This is showing some sort of germ tube formation. Next, here are the important points. We may see the oral thrush, or we may see the vaginal thrush. So what is this vaginal thrush, oral thrush? See, oral is indicating the oral cavity. So what's happening in the oral cavity? You're gonna see some sort of creamy, whitish discharges. or you're going to see some sort of patches in the buccal mucosa as well as the tongue. So if you see these particular patches on the tongue or on the what we say roof of your hard palate or soft palate or anywhere near your what we say the inner surface of your cheeks, so in these particular conditions you'll say it as oral thrush. And how to say it as vaginal thrush? Vaginal thrush is the whitish curdy discharge or the creamy discharge from the vagina. This is seen in I have already told you, right? This is seen during pregnancy. So this is seen during third trimester of pregnancy. Okay, the baby is about to come, the final trimester, and there might be a possibility of the candidal infection in that particular female. And the drug of choice for us is we're going to give her fluconazole 150 milligrams. Stat is a single dose, right? Or for if this candida invades the body and if it is going somewhere inside deep, so what we're going to give, then we need to go with the amphotericin B. If not, the fluconazole would be the best answer. But if they say that this candida is invading into the deep tissues, then you need to say that amphotericin B would be the better drug of choice. Okay, I would like to add one more point. For the all deep infections, amphotericin B is the best. I mean, it is the drug of choice for all the deep infections. Okay, guys, let's proceed. Next is our tinea or dermatophytosis. This is nothing but ringworm. Okay, this involves generally skin, nail, as well as hair. And particularly in ringworm, guys, yeah, this is common in India. You might have seen some people having some ringworm over their neck or sometimes in the region, I mean axilla region. Okay, so what you're gonna see, you're gonna see some sort of reddish ring-like structure, and inside it you're gonna see the paler area which is empty. So what does this suggest? This suggests that this is central clearing. So in the center you have nothing, everything is fine. So and you have the rash or the redness on the periphery like a ring. So this is called as central clearing. Okay, next we're going to see the types. We're going to see three types: trichophyton, epidermophyton, as well as microsporum. Okay, let us go with one by one. See, trichophyton. Tri, tri. What do you mean by tri? Tri is three, right? So this involves all the three structures, right? Skin, nail, as well as hair. Yeah, and this, what is the shape of this? Few guys say this is cylindrical shaped, few guys say it as pencil shaped. How to remember? You guys know, right? There will be some sort of few pencils which are triangular. Those are called as tri pencils. So just remember, try with pencil, tri pencil. So tri pencil, that is pencil shaped. Trichophytons are pencil shaped. These are macroconidia. Okay, the macroconidia are pencil shaped or the cylindrical shape, whereas the microconidia, these are numerous in number for trichophyton. And if it is epidermophyton, what do you need to see epidermophyton, the last alphabet is N, so obviously N should be present. So this is present in both skin as well as your nail, but that doesn't involve hair. Okay, next, what are the shape of it? You're going to see the pear shaped or boat shaped or the club shaped. And in this the microconidia are absolutely absent, completely absent. Next is your microsporum. So what do you mean by microsporum? I mean, where do we see this microsporum? See, there is no N at the end, so N is absent. So this involves your skin as well as hair, but not nail. Okay, never nail. This never involves nail. And we see very less or fewer microconidia. Okay, next, let us see the diseases. What are the diseases? Tinea capitis. This tinea capitis involves your scalp, the scalp area. Okay, most common cause in India is trichophyton violation. Okay, and the most common cause worldwide is microsporum canis. Next, we're going to see both carrion and flowers. I want to show these images also. Of course, I'll be showing and discussing all the images at the end once again. But yeah, these both are very important. So I would just like to jump towards the image, and I would like to clarify those images first of all for you guys. See, this is bogey swelling. Okay, what do we say? This is a bogey swelling seen in carrion, and these are some sort of yellowish patch kind of things on the scalp. Okay, this is nothing but your flavus. Okay, flavus. Yeah, I skipped these images. Yeah, now you guys can see this. This is the oral thrush. You can see this whitish curdy like patch on the tongue, surface of the tongue, as well as near the uvula, near the buccal cavities, etc. And this is the vaginal thrush. Near the vagina, you're gonna see this whitish discharges. See, whitish creamy curd like discharges. Okay, this is your vaginal thrush. Yeah, let's get back. Okay. So we saw the carrion, which is painful bogey swelling on the scalp, as well as we saw the favus, which is a dense crust formation on the scalp, or you see the yellow scales on the scalp. These both are also quite important. You might get some sort of image based questions on this. Okay, the images are quite important. That is why I have collected the images. Next, we're going to see the tinea barbi. The tinea barbi. This tinea barbi involves which organ? That's gonna involve your beard. Okay, if that is involving beard, we call it as tinea barbi. Barbie, whatever it is. Next, tinea unguum. Unguum is the term used for your nails. Okay, so if your nail folds get infected, we call it as, that might be due to tinea unguum. Next, tinea manum. Manum involves your hands. And tinea cruris. See, this tinea cruris is involving the groin. Groin is your the bottom area. uh, this There'll be severe itch in this case. So this itch is called as jock itch or the Dobie itch. Okay, this tinea cruris is most common among the all these types of tinea. And you're gonna see the tinea pedis. The organ affected is pedis is nothing but foot. So we see athletic foot. And tinea corporis involves all the hairy regions of the body, wherever the hair is present. Yeah, if it is a guy, he might be having chest hair. Okay, few hair on the trunk probably. So all might be the chances. Next, the most common cause is your Trichophyton rubrum. So for all this tinea barbi, tinea unguum, tinea manum, etc., what is the most common cause? The most common cause is Trichophyton rubrum, and the drug which we give in this particular condition is grisofulvin. Okay, the drug which we give is grisofulvin, and but the drug of choice is terbinafine, or we can even give the imidazole derivatives. And the last one is your pidra. Pidra is nothing but hair infection. Okay, we have two kinds of pidra. One is black pidra, other is white pidra. Okay, the black pidra is caused by pidra hotae. How to remember? Hot. If anything is very hot, it will eventually become black. Okay, so hot pidra or pidra hotae is the black pidra. And what we say, the white pedra is nothing but that is caused by Trichophyton bijli. Bijli, you know, right? Bijli, this is a Hindi word. That is nothing but lightning. So whenever you see lightning, you're going to see which color in the sky. You're going to see the white color, right? So this white color, so that is why this is called as uh, white pedra. So you can just memorize. See, pedra hotae is causing hot black pedra, and Trichophyton bijli white, so it is causing white pedra. Yeah, superb guys. So let's move on. Yeah, now we're going to see the subcutaneous infections, before which I would like to just give you some important points, okay, which we studied regarding the superficial infections. I would just like to repeat it once again. I'll take hardly a couple of minutes, but I'll just like to give you the important, the utmost important points, okay, which you need to memorize for sure. Tinea versicola or Pityriasis versicola. This is caused by what? Malassezia furfur or Malassezia globosi. Next, under wood lamp, which color you are seeing? You are going to see the golden yellow or the apple green color. In the microscopy, you're going to see the spaghetti meatball appearance or the noodle appearance. And the drug of choice is imidazole. Next, we're going to see the candida. Candida, as I already told you, this is an opportunistic infection, right? And oral thrush, I have shown the image also, some sort of near the tongue, some whitish curdy patches on the tongue, vulva, hard palate, soft palate, or inner surface of your cheeks, etc. So that might be a candidal infection. Oral thrush. Vaginal thrush, some sort of whitish discharges from the female, particularly in the pregnant female. That too we see in the third trimester. Okay, and the drug of choice first, fluconazole. Tinea. What did I say? How to remember? Okay, trichophyton, epidermophyton, microsporidium. Tri involving both all the three structures, skin, nail, and hair. Okay, tri pencil. I have given the mnemonic, so this is pencil shaped, and microconidia are numerous. Epidermophyton and phyton. So this is S, skin plus nail, and this is pear shaped, and the absence of microconidia. Next is microsporum. This involves skin plus hair. Okay, and this is sporum, sp. You see this sp, so the shape here is spindle shaped, and this never involves your nail. Okay, next, yeah, this tinea capitis, you need to identify the images, the bogey swelling on the painful bogey swelling on the scalp. This is Kirion. As soon as when I'm saying these points, try to memorize the image which I have shown you earlier. Okay. Next is the flavus. Flavus is nothing but yellowish scale. There was some boy or some baby who is having some sort of what we say yellowish color scales on his head, on his scalp. So that was flavus. And pedra, you guys already know, that is white pedra, Trichophyton bijli, and the black Pedra hotte. Yes, yes, guys, this is done. Now we're gonna move to our subcutaneous fungal infections. Yeah, this for the subcutaneous fungal infections, the first one is sporotrichosis. See, I want to give you some small story for this. Okay, everything should be not just mugging up, right? We need to make some sort of story, some sort of concept which will help us to retain the particular information for the longer time. So I'm going to say you this sporothrix. This is caused by sporothrix shechnil. This is the common in thorn pick injuries seen in farmers, and these incidents increased in and around Valentine's Day. Do you know the reason behind it? Yeah, obviously you guys might be knowing. On Valentine's Day, generally a guy used to present a flower to his female partner. So he's going to pick the flower, right? So during that, he might be picked with a thorn, okay? Due to which he may end up with sporotrichosis. This is called as gardener's disease or the rose gardener's disease. And this also involves lymphatics. Hmm? So let me say some small story, like how do the examiner make a question out of it. Probably MCQ. How does, I mean, how he'll be framing this particular MCQ? He might be giving you some story like, yeah, there was a farmer who was working in some sort of nursery. uh, it was a Valentine's Day is up, I mean, in couple of days. So farmer wants to pick all those flowers and make it ready to sell them. So while he was moving in the fields, and suddenly he got some sort of incidents. So I mean, he was moving on barefoot. Probably he might be giving anything, right? He was moving on barefoot, so he got some sort of injury with nail, anything. So based on this scenario which he gives us, just think like whenever he's saying this farmer barefoot, or what to say, something with thorn pick injury, your mind should immediately go for sporotrichosis. Okay, you see star-shaped asteroid bodies are seen in this particular disease, and the drug of choice is amphotericin B. Yeah, I would like to show this image also for the sporothrix. As I told you, right, this asteroid body. So how does this asteroid body seems? Yeah, here is the image. See guys, this first image, you are seeing some sort of stellate appearance. Stellate is nothing but star shaped appearance. Yeah, these are like star shaped appearance. Okay, that is due to sporothrix. He might give you some sort of image like this showing some sort of star appearance. Okay, so that you could easily identify the stuffs. Yeah. Next is mycetoma or the Madura foot. Okay, you see a particular triad in this patient. So what is that particular triad in this patient? That is subcutaneous nodule. You're going to see some sort of nodule on his foot, which is multiple discharge. I mean, you're going to see some sort of multiple discharging sinuses, and also you're going to see some sort of sulfur granules. Okay, this Madura foot is maybe actinomycetoma or eumycetoma. Okay, this eumycetoma is our point of concern. This is due to fungus. Most common is due to Madurella grigia, and this gives black color granules. Okay, the color of granules is quite important for us. You are black. Eumycetoma is giving black granules. Okay, on X-ray, see if a patient is suffering with mycetoma and you are observing his X-ray of his foot, so what you're gonna see? You're gonna see some sort of osteosclerotic lesions on his foot. Foot X-ray, I mean to say. Okay, osteosclerotic lesions, and the drug of choice would be our amphotericin B. Yeah. Next, what is this actinomycetoma doing? This is producing also some sort of granules which are either white in color or yellow in color, and this is due to bacteria. This is not, I mean, this actinomycetoma is not due to fungal cause. This is due to your bacterial cause like nocardia. And when you see the X-ray of this patient, you're going to see the osteolytic. Lytic is nothing but breakdown, right? So you're going to see some sort of opacities. That is I mean, due to some lysis of the osteophytes or the bone. So you're going to see some sort of osteolytic lesions over there. And the drug of choice would be your cotrimoxazole or sulfonamide. Very good. Next, we'll move to our chromoblastomycosis. Yeah. Uh, Wait a second. I want to show this image also priorly. Yeah, see this. This is your mycetoma of, or the Madura foot. Okay, you're gonna see the foot with multiple swellings, and there might be some sort of discharges like black color discharge, for example, if it is eumycetoma, or yellow color discharge if it would be the actinomycetoma. Okay, you guys should be very careful about it. Probability of an image based question. Yeah, let's move on. Next, we're going to see the chromoblastomycosis. Okay, this is dermatitis fungus, which is involving the skin and also the subcutaneous tissues. And you see the cauliflower growth. Okay, which growth you are seeing in this particular patient? You're going to see the cauliflower growth, and you observe copper penny bodies or the brown sclerotic body or the medlar body. Yeah, this copper penny bodies is also an important question for chromoblastomycosis. They might be giving you some sort of scenario, and at the end they say like you're gonna see some sort of bodies or the brown sclerotic bodies or the medlar bodies, and they might give you some image. See the image which is on your right side, this one. You're gonna see some sort of copper color, right? Copper color and looking like some penny, some sort of like coin like. So that is why we call it as copper penny bodies. Okay, what are those called as? Those are called as copper penny bodies seen in chromoblastomycosis. Very good. Next is your rhinosporidiosis. So what do you see in this rhinosporidiosis? This is caused by Rhinosporidium sebrae, which is an aquatic protozoan. Okay, this is seen generally in the people who generally bath in some sort of ponds or in some lakes. Okay, they might be bathing in some sort of stagnant area, and holy dips, you know, right? Ritually, uh, in India they follow, they take some sort of holy dips. So that might be a risk factor for this rhinosporidiosis as well. And the most common presentation is bilateral nasal polyps. You want to see the nasal polyps inside, and the treatment would be dapsone. And if you want to go with surgery, then your surgical option is removing of the polyp, cutting and removing. There is nothing but your polypectomy. Yeah. Next, this is about all our okay, subcutaneous fungal infections. I'm going to revise the subcutaneous fungal infections once again. First with sporothrix. Immediately, what should come into your mind? Some Gardner, thornpick, asteroid bodies, or cigar-shaped yeasts, Okay, and the drug of choice is amphotericin B. Mycetoma of foot or the Madura foot, eumycetoma, actinomycetoma, eumycetoma, black color granules, and on X-ray you're gonna see the osteosclerotic lesions. Drug of choice is amphotericin B caused by fungus, whereas actinomycetoma caused by your bacteria like nocardia, white or yellow color granules, and on X-ray you're gonna see the osteolytic lesions, and the drug of choice is cotrimoxazole or the sulfonamide. Okay, and next, wait a second, sorry. Next is our chromoblastomycosis. In this, the important point is our, what are those? Copper penny bodies. Yeah, copper penny bodies, brown sclerotic body or the medullary body. Whenever you see these points, immediately your brain should go for chromoblastomycosis. And the last one is our rhinosporidiosis. That is due to the rhinosporidium sebrum, which is an aquatic protozoan. Bath in the stagnant water. I mean, the risk factor is holy dips. Bilateral nasal polyps, treatment would be dapsone. If it's not working, then the surgery is the option, and in surgery we do polypectomy. Very good. Now we're going to see the deep fungal infections. Yeah, as far as it's a deep fungal infections, guys, I have told you priorly that the drug of choice for the deep fungal infections is amphotericin B. Okay, I have told this priorly, right? And I'm repeating once again, the drug of choice for the deep fungal infection is amphotericin B. Very good. So under these deep fungal infections, we're going to see the histoplasmosis, coccidiomycosis, blastomycosis, paracoccidiomycosis, and the penicilliosis. Okay, these are the 5 diseases we're going to see. Okay, we'll go one by one. For our first disease is histoplasmosis. Yeah, this histoplasmosis is caused by Histoplasma capsulatum. This is a non-capsulated organism, and this is transmitted through aerosol. Okay, or some pigeon feces, and this looks like lung TB. How is the presentation in case of histoplasmosis? The presentation would be like lung TB, and this disease is called as Darling disease. Just see histoplasma, hi, 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 and here Darling. So hi, Darling. You can remember like this, okay? Histoplasmosis, Darling disease. Next, the drug of choice is amphotericin B. As I told you, right? For all the deep infections, your drug of choice is amphotericin B, which I'm not going to repeat further. But for all these, the drug of choice is amphotericin B. Next is coccidiomycosis. This is caused by Coccidioides immitis. This is also used as bioterrorism agent. This spreads through rodents excreta. It has arthrospore or a barrel-shaped spore. Next, from here, points are important. You're going to see the blastomycosis. This is caused by Blastomyces dermatidis. This is also known as North American blastomycosis. And you're going to see the figure of 8 appearance in this. So which appearance you're going to see? Figure of 8 appearance. See, this alphabet B also looks like 8. Yeah. So the figure of 8 appearance is seen in blastomycosis. This is also known as North American blastomycosis. And paracoccidiomycosis is called as, other name for this is South American blastomycosis. And here you see pilot wheel appearance or a mariner wheel appearance. Okay, I'm going to show these images before going to penicilliosis, because these are also the probability of questions in the exam. Yeah, you're going to see this. I told you, right? Pilot wheel or the mariner's wheel, for huge cruise ships or some sort of good ships which are traveling in oceans. There will be some sort of steering like structure, right? You might have seen even the Pirates of Caribbean, etc. Okay, these kind of structures. And see, in the last image on your right, you're going to see the figure of 8 appearance, 8 seen in blastomycosis. Okay, and guys, where do we see this? We say this mariner wheel appearance or the pilot wheel appearance in the paracoccidiomycosis, and the figure of 8 appearance is seen in blastomycosis. These are also probability of image based questions. And the penicilliosis caused by Penicillium marfani. This is common in HIV patients, and this produces brick red colored pigment. And the last point, as I told you guys, for all the deep fungal infections, our drug of choice would be amphoterican B. Next, now we're gonna see the opportunistic infections, and the mnemonic for this is CAMP. CAMP, CAMP. Okay, what are opportunistic infections? We have discussed them earlier already. I mean, what this is? These infections affect the person when the immunity of a particular person is low. Like in case of HIV, if the CD4 cells count decreases, then he might be ending up with these opportunistic infections, or even the diabetes mellitus patients, DM. Even in these particular patients, they might be affected with these opportunistic infections. Okay, so let us see the names first of all. C for our Candida and Cryptococcus. Candida, uh, we studied it right before. Oral thrush, vaginal thrush, all those points. Yeah, the same Candida. I have mentioned it over there also. Candida is an opportunistic infection. Cryptococcus, and A for Aspergillus, M for mucormycosis, which is also known as your zygomycosis, and last is the pneumocystis. This pneumocystis is the only fungus which lacks ergosterol in cell wall. Okay, all the fungus has what you say this ergosterol in their cell wall, but the only fungus in which the ergosterol is absent is your pneumocystis. Okay, pneumocystis. And while explaining the stains, probably I don't know whether you guys remember it or not. That is quite important. So I'm coming once again over there. Where is that slide of stains? Yeah, here I told you this is gomo pneumo pneumocystis. The stain is gomori stain. Okay, guys, for pneumocystis the stain is gomori stain. Yeah, now we'll go with one by one. Oh, before that I'll say you the aseptate fungus. I have mentioned, I mean, I have shown you the image before, right? Aseptate fungus. Okay, septate fungus and aseptate fungus. I have given the examples as well. The septate fungus, the example, sorry, is Aspergillus, whereas for the aseptate fungus, in which the septa is completely absent, that is your, how to remember RAM, 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 that is your Rhizopus, Absida, and Mucor. So in these three particular fungus, you see these are aseptate fungus. There is no septa present. Okay. Yeah, now coming with your cryptococcus. Your Candida is already done, so we are coming with our cryptococcus. As I already told you, cryptococcus is the only fungus which is capsulated, right? So the cryptococcus neoformis is a capsulated fungus. This is the only yeast which is pathogenic. Generally yeasts are not much of pathogenic, but the only yeast which is pathogenic is cryptococcus neoformis. Next, most common type is type A. There are many types in this cryptococcus neoformis, like A, B, C, D, E, etc. So out of them, A would be the, what is the most common type. This is also known as European blastomycosis. Okay, this cryptococcus neoformis, this might be a possibility of question. They may directly say you like which of the following is also known as European blastomycosis, and they might be giving you many options. So the option which you need to choose is cryptococcus neoformis. In this, the urease test is positive and also phenyl oxidase test is positive. So how do you gonna diagnose this cryptococcus neoformis? You're going to do the lumbar puncture of a particular patient. You're going to take the CSF out, the cerebrospinal fluid, and you're going to use the Indian ink stain. Have Indian ink stain, do you remember, guys? I have told you this is a negative stain useful for the capsulated organisms and a dark background. Okay, all those points we need to repeat once again. And this is your on culture on SDA. Yeah, when you SDA, Seborrheic dextrose agar, you remember, right, guys? And the pH at which the fungus grows is 5.4. Okay, those points are important. That is why I have mentioned them earlier. Okay, on culture on SDA, this is mucoid or smooth in color, and on Niger seed agar, you're going to see the blackish brownish colonies. Okay, and also you can use this latex card agglutination test for the antigen, or you can even use the PCR, that is polymerase chain reactions, etc. And the drug of choice for this is also amphoterican B. Okay, what is the drug of choice? Your drug of choice would be amphotericin B. Next, we are going to aspergillus. Aspergillus, I have already told you, right? Are these septate fungus or aseptate? Septate. So, in this fungi, septa are present. And the important point which you need to remember in this particular fungus is they show dichotomy. What do you mean by dichotomy? See, the fungus is branching, and the angle between the two branches is somewhere around 45 degrees. Okay, 45-degree branching, that is called as dichotomy. Oh, what do we say? Dichotomy. These aspergillus, they generally are the green color colonies. You know what, these days there are many questions, they are concentrating on the color green. So you need to remember this also, the green color colonies are seen in aspergillus. And this aspergillus is the most common cause of fungal keratitis, fungal sinusitis, as well as the fungal allergy. So whenever they use fungal keratitis, fungal sinusitis, fungal allergy, then the answer would be your aspergillus. And we have the many types of aspergillus. We'll go one by one. We'll see the aspergillus niger, niger, negro, something with black. So blackish crusts are seen, which causes otomycosis. Oto, something related with ear. Okay, otomycosis. You'll be learning this in ENT as well. Next is your aspergillus flavus. So what is this? We have studied this. This produces aflatoxin. Okay, this aflatoxin is associated with HCC, hepatocellular cancer. Okay, next is Aspergillus clavatus, which causes Malster's lung disease. This is common in malt or barley factory workers. This is also an occupational disease. Next, Aspergillus fumigatus. Okay, this causes ABPA. What is ABPA? Allergic bronchopulmonary aspergillosis, or this forms the aspergilloma or the fungal ball, or the oculomycosis, something related with the eye, or also otomycosis, ear as well. And the lab diagnosis, what you're gonna do? You're gonna take the tissue biopsy, and you're gonna stain with hematoxylin and eosin H&E stain, and you're gonna see the septate hyphae showing dichotomy, dichotomous branching. Generally acute angles somewhere around 45 degree. Okay. Next is pneumocystis. Pneumo. And I have given you some pointer. Pneumo. The stain is gomo, gomori methamine stain. And these are the only fungus which lack ergosterol in the cell, in their cell wall. All the other fungus has ergosterol in their cell wall. Exception for this is pneumocystis. Okay, pneumocystis. And this pneumocystis is divided into two types. What are those? Pneumocystis carini and pneumocystis jeroviaceae. Okay, and this pneumocystis carini generally affects the rats, and this pneumocystis jeroviaceae is affecting or attacking humans. And this pneumocystis jeroviaceae is the most common cause of atypical pneumonia in HIV patients, where the what we say the CD4 count is less than 200. This is also an important question, and this involves type 1 alveolar macrophages. Next, for diagnosis, we do BAL. BAL. Generally in FMT, we guys read that BAL is an antidote for that poisoning, this poisoning. Okay, this is not that BAL. This is different. This is bronchoalveolar lavage. So in this bronchoalveolar lavage, what you're gonna see? You're gonna see the neutrophils and also the interleukin 8, and the stain, which I have already told you the important point, gomori methamine stain. This is not cultured on SDA, not on seborrheic dextroagar, and the drug of choice is cotrimoxazole. The drug of choice for the pneumocystis is cotrimoxazole. Next is the occupational lung disease. See, this is small point. I mean, there are only 4 diseases in this. What are those? You're gonna see this farmer's lung. This is type 3 hypersensitivity, guys. Just remember this point. First of all, whenever I say the farmer's lung, this farmer's lung is due to the hay dust. This is caused by thermoactinomycetes vulgaris, and the hypersensitivity is type 3 hypersensitivity. Okay, 3 important points. Farmer's lung caused by haze dust, sorry, that is due to haze dust, which is caused by thermoactinomycetes vulgaris, and this causes hypersensitivity pneumonitis, that is type 3 hypersensitivity. Next is bagosis. This is due to sugarcane dust and caused by thermoactinomyces saccari. Why I'm using this saccari? See, sucker or sugar. Okay, they are packed in bag. So bagosis due to sugarcane dust. Okay, caused by thermoactinomyces saccari. Next is Malaster's lung. This is due to barley and malt caused by Aspergillus clavatus. Pidra, you guys already know the hair infection. Two types of pidra, the white pidra and the black pidra. White pidra is due to bijli, trichosporon bijli, and the black pidra is due to hot pidra hotte. Next, guys, this is about the topic, but I want to add some additional points. See, the thing here is, in recent days, post COVID, we in few patients they are right now suffering with mucormycosis. Yeah, and this disease is fatal as well. I mean, many people are losing their lives. So how this is happening? I mean, the only treatment which we are giving for this COVID-19 is the steroids, okay, or the immunosuppressants, because there is cytokine storm in their body due to we need to suppress that for COVID, right? So we are giving plenty of steroids, we are giving the immunosuppressants, so the patients their immunity is getting less. So as soon as they are home, they are nowadays they are being affected by this fungus called as mucor. So, and what's happening, that is initially affecting the nose, and eventually it spreads to eye. As soon as it spreads to eye, the eye starts becoming red. Some sort of teardrops continuously will be flowing, and you'll see some sort of swelling in the eye, and eventually they are becoming blind. And once when this fungus is reaching the brain, then they are being dead. So this is quite fatal. Guys, see, this is happening. This is seen like almost 5 to 10 days back, I guess. This is seen in Gujarat initially, but after that this is spreading, guys. This is going, I mean, few cases are even seen in Delhi as well these days. So we need to be very careful. Okay, now as the COVID-19 is a pandemic, it is affecting majority of the people. So as soon as they are well, I mean, as soon as they get what do you say, they are coming out of the hospitals, they should be very careful. They should not move outside. They should take care of themselves. They should have their regular exercise. They should have plenty of fluids, etc. See, the as it was a necessity, we decreased our immune system. But once we are back home, by giving steroids and all, we suppress the immune system. But right now he's okay, right? So we need to improve his immunity again. But instead of it, if he is moving here and there, and this fungus actually, see, that might be present on any contaminated surface by chance if you have touched it. So you might be affected with this mucormycosis. Okay, so you should be very careful. Okay, at least for 5 to 6 weeks after COVID you should be very careful, guys. Okay, yeah. And now we're gonna see these images once again. This is Pitriasis versicola, as I already told you, and in microscopy you're gonna see this spaghetti meatball appearance. Yeah, this is, what is this? This is the oral candidiasis or the oral thrush. This is vaginal candidiasis. This is our bogey swelling, carrion, and this is our yellowish scales on the scalp, that is flavus. Okay, guys, and yeah, these are the star shaped asteroid bodies. Okay, do you remember, guys? This is your madurella or the mycetoma of foot. These are chromoblastomycosis, the copper penny structures. This is your what is it, paracoccidiomycosis, the what we say, this mariner's wheel or the pilot wheel. See, these both are same, and here you're gonna see the 8. So this is your blastomycosis. Okay, guys, thank you. Hope you like this video. uh, Enjoy the class. Just go through this file once again, and I guess I have given all the majority of the points, and I have given you how to remember them as well. Just go through this video once, and try to write the notes or do something, and just revise it once. Yes, and you'll be perfect for this mycology for sure. Okay, this is quite important topic actually. In all the competitive exams, at least one or two questions. See, you guys may think one or two is small, but this becomes a game changer, right? So just read this topic, just spend your 1 hour, not more than that, and you'll be perfect with this topic. Thank you guys. Thank you very much. Bye bye. Take care.